3, 2, 1.
Good afternoon, everyone. Thank you all for joining us on this wonderful, wonderful Thursday afternoon. Let's big up ourselves for making it through this wonderful day. I just want to officially welcome us to the annual Pamela McNeil Lecture on Adolescent Pregnancy, hosted by the Women's Center Foundation of Jamaica. Before we get started, I want everybody who is able to just quickly greet each other in the chat. If you can, put up your little flag about where you're from. If you can also mention the organization or just where you are in life. And we just want to have a wonderfully entertaining and informative and productive lecture this afternoon. I just want all of us to just greetings. We're in virtual world, so we can do the clap hand emojis for our wonderful panelists that we see this afternoon. The program would have been shared or should have been shared with you, but in any case, I will go through a quick running order. My name is Shauna K. Burns. I am an instructor. Greetings from Botswana. All right, Dr. Dunn. My name is Shauna K. Burns. I am an instructor in social work and also a gender advocate and also a social action theater advocate here in Jamaica, West Indies. And we are just going to have an awesome time today. We will start with greetings and opening remarks from our wonderful panelists, which include Dr. Karen Carpenter, Dr. Zoe Simpson, Mrs. Debbie Brown Salmon, and our representative from the Minister of Gender, Culture, Entertainment and Sports, which is Mrs. Sharon Coburn Robinson. Then we will go into our lecture and we will have a Q&A section after that. So again, guys, we just want to thank you for joining us and welcome you all to this wonderful lecture. So the annual Pamela McNeil Lecture on Adolescent Pregnancy is a signature event of the Women's Center Foundation of Jamaica and was first delivered in 2018 when the organization celebrated its 40th anniversary. Let's take a short time to just big up the Women's Center for 40 years at 2018. So who would do the math counting down where we are now, right? It is annually delivered during the month of November to coincide with the national focus on education and parenting, which, as we know, are two pivotal cornerstones of the program itself for adolescent mothers. And this year's lecture, we know, is under the theme, the impact of the pandemic on the rate of adolescent pregnancy in Jamaica, separating fact from fiction, which we are so looking forward to, and will be delivered by Dr. Leith Dunn, noted Jamaican sociologist and gender analyst. She's currently an honorary research fellow and the former head of the Institute for Gender and Development Studies, Mona Unit at the University of the West Indies, Mona, and living my personal dream as a research affiliate under the Department of Sociology at the University of Botswana. The Women's Center of Jamaica is a government agency which has the mandate to provide adolescent mothers with continuing education during their pregnancy, which we know is oh so important. The foundation is presently situated under the Ministry of Culture, Gender, Entertainment and Sports and delivers the program for adolescent mothers at 10 main centers and 8 outreach stations island-wide. The young mothers are reintegrated into the formal school system after the birth of their wonderful children. And to date, the foundation has assisted over 50,000 adolescent mothers. Let's put some hands together for that. Let's have our virtual hands up. Some of the main objectives this afternoon will be to increase the public awareness around adolescent pregnancy, examine some trends around this issue, assess the progress made to date, and call attention to the work of the foundation itself. And it also will culminate in a call to action for the wider national and international population. So again, we want to thank you for joining us this afternoon, and we will get straight into the greetings. We will start with greetings from Mrs. Debbie Brown Salmon, which is the chairperson of the Board of Directors at the foundation, followed by Dr. Karen Carpenter, the senior lecturer and current head of the Institute of Gender and Development Mona unit, and then I will join you back. So Mrs. Salmon, Dr. Salmon, take it away.
Okay, almost thought I lost my picture there a while ago. Just a tad bit of technical difficulty, but I'm back on. I am so excited about today and so excited about this lecture, as we always are at the Women's Center of Jamaica Foundation. We do this lecture every year. Well, we've been doing this lecture since 2018. Dr. Simpson can correct me on that, but I do believe it's from 2018 that we've been doing this. And it's been successful. Every single year, the discussion is just so much more interesting than the year before. Last year, we had the topic we discussed on the platform was adolescent pregnancy, breaking the cycle, protecting our girls, right? That's what we discussed, and it was just riveting. And I'm really waiting to hear today what our dear and very own Dr. Dunn has prepared for us, and the discussions that will take place afterwards. So good afternoon, everyone. Good afternoon, good afternoon. In the virtual world, I see up to 63 participants, including the panelists right now, and I'm hoping that more will come on. So share it on your very own platforms so that others can see. So WhatsApp is an easy place to share it as well, to put it in your status so others can join this very important discussion. Thank you all. Thank you all for coming on today, for joining us, for seeing the necessity in being a part of this very important conversation that we're going to be having today. Thank you for taking the time. I know everybody's day is busy, but we appreciate you being here and being a part of today's discussion. Today's topic, I know the moderator said it before, the impact of the pandemic on the rate of adolescent pregnancy in Jamaica. Is there an impact or is there not an impact? Well, we'll find out in a few when we hear from Dr. Dunn. Separating fact from fiction. Fact or fiction? We will find out, we will discuss, we'll hear from Dr. Dunn's presentation. I just want to mention a few other of our, I know the moderator mentioned a few names before, but I think it's necessary that we mention these people again because they have taken time out of their busy schedule to be here with us today, and we really, really appreciate it and think we need to highlight them. So we spoke about Dr. Dunn. Welcome is also extended to thank you, moderator. We must welcome our moderator. I cannot forget her. Thank you for accepting and welcoming you.
All right, I think she has been frozen. Mrs. Salmon? And we got so quite used to this over the last couple of years, doing our virtual, so many things that we had to do. Mrs. Salmon, you seem to have frozen. So what we will do when you're able to join us back on, we will just move straight to Dr. Carpenter. You muted, Dr. Carpenter.
Thank you. We have to keep reminding ourselves to unmute. Thank you for that. I was saying good afternoon, good night, or good morning, depending on where you are in the world. Some of us are already in the night, yes, and others of us are in the morning. So I'm bringing you greetings, and in the Jamaican style, we usually call names when we bring greetings. First of all, I want to say the Institute for Gender and Development Studies is really very pleased to be included in this lecture, both in terms of the former head and myself. It's a beautiful and easy baton exchange, and we both support the Women's Center in everything that it does. We recognize its importance for our young women and their partners and their children in the society, and a tremendous continuity of the work that they've done. Like the rest of you, I'm looking forward to Dr. Dunn's lecture, which no doubt I will get a copy of, yes? So I'm affirming that, right? And I want to thank the staff at the Women's Center for extending the invitation to us both. And thank you, Dr. Zoe, and also to the director, who we just lost, Mrs. Salmon, who I'm sure will join us again. I want everyone to really pay attention to what distinguishes what we think we know from what we actually do know about the pandemic, as Dr. Dunn presents, and very proud to be a part of any support for the Women's Center as we move along. Thank you for taking the time to have us with you today, and enjoy the lecture.
Thank you so much, Dr. Carpenter. So now we will move on to our representative from the Ministry of Gender, Entertainment, Culture and Sports, Mrs. Sharon Coburn Robinson. Good afternoon.
Good afternoon, and thank you so much, Shauna Kay. You know, I heard my chair earlier say that she was excited, but I don't think she's more excited than I am, and for a number of reasons, yes? So first of all, I wish to greet you, Shauna Kay. I know you're bursting at your seams. We all are, and we've been waiting breathlessly and just, you know, waiting for this lecture because, as you know, our guest lecturer, Dr. Leith Dunn, sociologist and gender analyst, honorary research fellow and former head of the Institute for Gender and Development Studies, is always rich with lots of information, very innovative in her thoughts. And being an advocate, we expect to have a rich discussion and to have our plates filled up this afternoon. Now, I have the distinct pleasure of sitting in for the minister who has carriage for the portfolio that we manage. That's Dr. Simpson and myself, that being the gender portfolio. And I just wish to apologize on behalf of the minister. That's our esteemed Minister Olivia Grange, OJ, CDMP. She is unavoidably absent and asked me to fill in for her. So I heard the previous speaker say she wanted to greet a few persons. I think my list is a little bit longer because I'm actually speaking on behalf of the minister. So I really have to call a few more names if you will indulge me. So my chair spoke earlier, and I'm sorry that she dropped out. I think she'll join again. Chair of the Board of Directors and other members of the Board of Directors of the Women's Center of Jamaica Foundation. I must greet my partner, Dr. Zoe Simpson, Executive Director of the Women's Center of Jamaica Foundation, and her dedicated staff who worked assiduously behind the scenes to make sure that today happened. Your back, Chair, wonderful. I also wish to greet in her absence Professor Diana Fox. I learned today that she is a new university director, and also in this room as a panelist, Dr. Karen Carpenter, who you heard from just now. She is playing baton change with Dr. John, who was the former head of department, and now Dr. Carpenter has slid nicely into those shoes. Dr. Jason Winter, I have here, head of the Behavioral Science NCU. I also wish to greet Dr. Wayne Henry. I was told he's on, Director General Planning Institute of Jamaica, one of our very outstanding partners. And although he's a male, he is a gender advocate, I must say. I also wish to greet Mrs. Joel Quayler Rosberg, who is at this point officer in charge for the UNFPA Sub-Regional Office for the Caribbean, and Dr. Denisha Vance, who was our guest lecturer about 2 years ago. She is now the HIV and AIDS officer with the UNFPA. I think she's supposed to be in this meeting as well. I also wish to greet the rep AI for UNICEF. That's Vincenti Terran. Hope I didn't spoil his name. And Dr. Cassandra, acting CEO, Ministry of Education and Youth. I also wish to greet Her Honor, Mrs. Paula Blake Powell, an advocate for the Women's Center. I know Dr. Dunn would not, Dr. Simpson would not allow me to not read her because she has been working so assiduously and is so passionate about the cause of the Women's Center. I also have Her Honor, Justice Carol Edwards. Just a few more. I have Mrs. Princess Laws, because she was one of the former directors, former chair of the Women's Center board, and has distinguished herself in many ways. And so I'm greeting her for a number of reasons. I have here as well members from the CARICOM Secretariat who would be on this call, members from the Botswana University, of course, with Dr. Dunn in tow. I would expect that she would have a strong showing from the Botswana University. And then I have, ladies and gentlemen, past students, current students, and all other persons who I would not have listed. I would want to greet you and say a pleasant afternoon and welcome to this very riveting lecture. So the annual Pamela McNeil Lecture on Adolescent Pregnancy is a signatory activity of the Women's Center of Jamaica Foundation and was first delivered, as you heard rightly, in 2018 when the organization celebrated its 40th anniversary. The lecture is named in honor of the first national director and is delivered during the month of November. And that is because it coincides with the national focus on education and parenting, as well as two pivotal cornerstones of the program for adolescent mothers, officially called and affectionately called PAM. What are the broad objectives of this particular lecture? There are just 5 that I wish to call out very quickly for you. In a general sense, the Pamela McNeil Lecture is focused on doing a number of things. One, essentially, is to increase public awareness about this very vexed issue of adolescent pregnancy, to examine trends that are surrounding this important issue, to assess the progress made, certainly, to address the issues related to adolescent pregnancy, to call attention to the work of the Women's Center of Jamaica Foundation, my alma mater, and finally, but not least, to issue a call of action to the wider national, international population, meaning everybody who thinks that this is an important issue. Then we call you in. And if you did not know that it's important, the fact that you're on this call, by the time you leave here, you will recognize how important it is. So this 2022 staging of the Pamela McNeil Lecture on Adolescent Pregnancy comes at a very appropriate time, we think. For 2 years, as you heard rightly mentioned earlier, the COVID-19 pandemic has disrupted life as we knew it. Students received their education online, in their homes, and in some cases, some students did not receive academic instruction for one reason or another. Against that background, we have heard many stories and speculations and anecdotal stories that the pandemic impacted the rate of teen pregnancy in Jamaica. So the RJR, for example, in May 2021, carried a news story which addressed the issue of teenage pregnancy in Jamaica. And it noted that in that news story, that SISOCA, that's the Center for the Investigation of Sexual Offenses and Child Abuse, the reports came in that there was an increase in teen pregnancy during that period. We have seen in November of last year, 2021, where experts warned that a prolonged school closure could lead to more teen mothers and unsafe abortion. There are those who think otherwise. I'm very pleased at this point, as Minister of Culture, Gender, Entertainment, and Sport, to be a proactive minister and to have courage for a proactive agency, such as the Women's Center of Jamaica Foundation. I understand that this year's theme, I'm very happy to announce, that the theme, impact of the pandemic on the rate of adolescent pregnancy in Jamaica, separating fact from fiction, is indeed appropriately timed and appropriately coined. And so that will allow us to be able to see how our very esteemed guest lecturer, Dr. Leith Dunn, one of my most impactful mentors, will be able to analyze this particular issue and to share rich content that will enable us to be informed, entertained, motivated, inspired, and be able to do our part as we move forward. On the premise that we will be significantly impacted, I'm delighted to learn that for the next 3 years, the Institute for Gender and Development Studies, IGDS, as you know it, will be the title sponsor of the Pamela McNeil Lecture for Adolescent Pregnancy. That deserves an applause. Under this arrangement, the Institute will conduct research aimed at uncovering trends relating to adolescent pregnancy and will also work very assiduously in close collaboration with the foundation to ensure that the wide network expands and the reach of the program, that's the PAM, the Program for Adolescent Mother, is also expanding. So thanks to the team at the Women's Center of Jamaica Foundation, and of course, the head uncle, Dr. Zoe Simpson, and the board of directors, with Mrs. Salmon at the helm, for continuing to give of your best in serving our adolescent mothers and their babies. Special thanks to you, Dr. Carpenter, at the Institute of Jamaica, for partnering with the foundation to better serve our student mothers. I am confident that we continue on this path because we understand the importance of making sure that we are a part of that vision 2030. So together we will make Jamaica the place to work, live, do business, and raise families. Delivered on behalf of the Honorable Olivia Grange, OJCD MP, I thank you.
And we thank you so much for greetings. And we know that you will transfer our deep thanks to the minister as well. Thank you so much. Mrs. Salmon, as we see that you're back on, did you want to finish your welcome, or is there anything that you did not get a chance to say that you want to do before we quickly move into our main presentation?
No, I will take up no further time. I'm very sorry. I just had some technical difficulties earlier, and I really hope that my device hangs in with me. But I believe all has been said now. I don't want to be repetitive and say things that have been mentioned already, but I just wanted to welcome everyone to the platform, everyone to the discussion and the conversation that will be opened up shortly. And thank you all for being present. And I wish you a very successful presentation as we continue and anticipate Dr. Dunn's delivery in a few. Thank you, everyone. I said the numbers climbing. We're at 81. Thank you so much, everybody, and have a great discussion. I'm still here on the platform and looking forward to the discussions to come.
All right, thank you so much. I'm seeing 90 people right now. It's awesome. I would like to invite people in the chat to just go ahead. If you can drop your flag from where you're coming in from or your organization, or just to send greetings. Thank you so much. So I have the continued pleasure of right now introducing our guest speaker, one of my favorite people, actually, such a warm spirit. And a contagious smile, as you can well see on our screen. Dr. Leith Dunn is a Jamaican sociologist and gender analyst. She is currently an honorary research fellow and the former head of the Institute of Gender and Development Studies, Mona unit at the University of the West Indies, which offers the only Bachelor of Science in Gender and Development in our region. Her teaching, research, publications, and training include a focus on adolescent sexual and reproductive health and rights, women's rights, gender-based violence, sexual harassment, and gender mainstreaming in development policies and programs. The IGDS Mona unit has had a long partnership with the Women's Center of Jamaica Foundation and co-hosted events for the 40th anniversary celebrations. Dr. Dunn previously worked with regional and international agencies, including the UNFPA as assistant representative for the English and Dutch speaking Caribbean. She currently lives in Botswana and is a research affiliate with the Department of Sociology at the University of Botswana. Dr. Dunn, I am coming to join you. Make some room. All right, ladies and gentlemen, if you could, let's see those hand clapping emojis as we welcome Dr. Dunn. Take it away, Dr. Dunn.
Yes, good day, everyone. Good evening, good night. I'm really honored and delighted to be here presenting this lecture. And I give God thanks for the opportunity that has provided, all the prayers that have been offered, crossing bandwidth and content and everything, electricity also. So today we're at a very important juncture, and I'll just move into this presentation. First of all, well, let me go to my first slide. So this soapstone sculpture from Victoria Falls really is of a teenage mother. And we see the hope in our eyes, the questions and everything. And that is the situation that many of our teenage mothers have to encounter. So we really are thankful for the work of the Women's Center Foundation of Jamaica. I want to thank Mrs. Pamela McNeil, late Mrs. Pamela McNeil, for her vision, the successive support over the decades for the growth of the foundation, the work of the Women's Center of Jamaica Foundation, Mrs. Beryl Ware, a former executive director, and Dr. Zoe Simpson, the current director. So I want to really look at the Women's Center at 44, its past, present, and future, some trends, global and national, our commitments to adolescent girls, the context in which we're having this discussion, highlighting COVID, climate change, and the pandemic of gender-based violence around the world, but also raising some questions about counting the births, the pregnancies, and the gaps. And then we have some conclusions and recommendations. So the PAM, the Program for Adolescent Mothers, really offers academic instruction for returning and pregnant girls who are returning to school and completing their education. It provides pregnancy prevention for them, parenting and child nutrition education, as well as family planning, counseling, and services. Also importantly, it helps to build their self-esteem and life skills, because the experience of adolescent pregnancy and the stigma and discrimination against teen pregnancies is something that they have to overcome. It also offers job training and job placement assistance, counseling and support for adolescent fathers, which I think is one of the most important aspects, engaging them, and also advocacy to change laws and policies that affect pregnant and parenting teens. So what have been some of the achievements? The PAM was established, expanded to these 18 locations, 10 main centers and 8 others. It has had global recognition, and I know that we have Pam Grenada here with us, maybe there are others. As noted before, over 50,000 pregnant adolescent girls have been served. The majority of them have completed secondary school. The innovative A stream for tertiary education has been introduced with bursaries, scholarships. The curriculum has not only been established, but it has been revised and updated. And then services and partnerships have expanded. The government approved the reintegration policy for schoolgirls when formerly it would have been left up to the principal or other person to decide if they should return to school. And they established the Pamela McNeil Annual Lecture, as mentioned, in 2018. Also important is that a strategic plan was developed in 22 for Wave 4, which is the next steps. So this, I wanted to just highlight some of the elements of the policy for the reintegration of school-age mothers, which was approved in 2013. So there's an automatic referral of pregnant girls to the Women's Center Foundation from the health system and from schools, the reintegration into their original school or in another school at the same level, monitoring to ensure that they complete their secondary education, but also prevention messages to reduce the incidence of teen pregnancy. And the recommendation, the takeaway from today is that the Women's Center of Jamaica Foundation should evaluate and update the policy because we have the 10th anniversary next year. So when hearing about declining numbers, and this image shows us the trends in the enrollment what are the causes and what are the implications? So you'll see from 2019-20, there has been a general decline. And next, look at the trends in adolescent fertility in Jamaica. And what do we find? The Registrar General's Department gives us data which shows a 3% decline in births to teens between 2020 and 2021. So there were 4,118 in 2020, and in 2021, we had 3,715. So that's a 3% decline. The World Bank in 2020 also noted a decline of 48.44% in the decade between 2010 and 2020. Then we see here the World Bank also noting that the number of teenage mothers between 1997 and 2009 actually declined from 26,600 to 13,700. So we can see a steady decline in these numbers. And the age-specific adolescent fertility rates of girls 15 to 19 years between 20 and 21 declined 57, from 2000 to 2021, declined 57.2%. So in 2000, there was 74.8 live births per 1,000 women. And in 2021, this had gone to 32 live births per 1,000 women. And that is from the Pan American Health Organization. I want next to look at the global trends in adolescent pregnancies. And this is a map from the United Nations Population Fund. A bit dated, but in essence, it showed that there were higher risks of adolescent pregnancies in poor countries. The conclusion of UNFPA in their report in 2022 was that gender and income inequalities drive teenage motherhood in developing countries. And I have a quote from the executive director, and she says, when nearly a third of all women in developing countries are becoming mothers during adolescence, it is clear the world is failing adolescent girls. The repeat pregnancies we see among adolescent mothers are a glaring signpost that they desperately need sexual and reproductive health information and services. And if you haven't already looked at it, please download the UNFPA's State of the World Population Report for 2022. And I've extracted some of the key messages. So they're looking here at unintended pregnancy, the crisis of unintended pregnancy, and the title is Seeing the Unseen. And they speak about this invisible crisis before our eyes, noting that the evidence is in unintended pregnancy is linked to lack of development, and every woman is at risk. Erosion of agency leads to unintended pregnancy, and we'll look at that in more detail during this presentation. And unintended pregnancies are not just around adolescents, as Dr. Carpenter reminded me, but women who are in their menopausal years who may have stopped using contraceptives and then discover that they're pregnant. So there's lots of work to be done. The report also has a very interesting area on motherhood and childhood, and here are some of the key findings reported. 1 in 3 young women aged 20 to 24 gave birth in adolescence between the ages of 10 and 19. 45 of first-time adolescent mothers are children. They're under 17 and younger. And that reflects, however, declining rates from 60% to 45% over 6 decades. They also note that 50% of adolescent births occur to girls who start childbearing in childhood. 54% of non-first births to adolescent mothers are a rapid repeat pregnancy. So one of the things that the center, the foundation does is to try and reduce the risk of a second pregnancy during adolescence. The 2022 report also note that 13% of all young women in developing countries begin childbearing in childhood. So this is very startling. In the words of UNFPA, shame, stigma, fear, poverty, gender inequality, and many other factors undermine women and girls' ability to exercise choice. So the unintended pregnancy is linked to lack of development. So we have a global audience today, so I decided to pull in some data from the World Bank and other sources. And the global rate of adolescent pregnancies is 41. That's from the World Bank in 2020. Jamaica, it's 48.5. And I've noted the numbers there for other Caribbean countries, selected of them. But in Botswana, it was 44, 1 in 10 teens, 9.7 according to UNFPA. But there was a 20% increase in defilement during lockdown, which is from a UN report. Next door in South Africa, the rate was 68. And in Cape Town, they reported 90,000 pregnancies to 10 to 19-year-olds between April 2020 to March 2022. So they see an uptick in pregnancies linked to COVID. Well, in the US, the rate was 16, 3 in 10 teens get pregnant at least once before the age of 20 years, and 50% of those girls in the US do not complete high school. In Zambia, the number was 115, in Zimbabwe, 77. But the highest rate of adolescent pregnancy was 143 per 1,000 in a sub-Saharan African country, which was not named. My colleague, Dr. Gwen Lesedi, shared this Botswana Gazette photo, which I think is also underscoring this problem. Over 5,000 girls in Botswana were defiled between 2019 and 2021, according to the police. And we can look at that. So the problem is not just in Jamaica, but also here. The Lancet Journal, their adolescent and health component, had a very interesting article this month, which says that in the Latin American Caribbean region, we have 106 million children, 10 to 19 years. And our region has the second highest rate of adolescent mortality in the world. And the primary causes were related to violence, injury, drowning, and suicide. We note that for boys, it was higher, but for girls, the greatest risk is adolescent pregnancy, which accounts for 14% of all births. And they noted, the Lancet article did, that by 2030, the Latin American Caribbean region will have the highest rates of adolescent pregnancy worldwide because of decades of entrenched sexual violence, stigma, inadequate sexual health and education, and access to contraceptives. Those of you who know me will know that I'm very committed to seeing looking at the commitments we have made to human rights and sustainable development. So in this section, I look at some conventions which are relevant, climate change, and the sustainable development goals. And I draw attention to the fact that we have ratified the CEDAW Convention, the Women's Rights Convention, the Convention on the Rights of the Child in the Middle, the Convention on the Rights of Persons with Disabilities, as well as the ICPD Program of Action, which is the 1994 Cairo Agenda, which says that we have sexual and reproductive health and rights for all. So we have made these commitments, and as a consequence, it is important for us to look at the work of the Women's Center Foundation of Jamaica against this background to see that we are fulfilling these commitments. But I'm also proud that we have a national policy for gender equality, which is being updated. We have a Vision 2030, which is our strategic plan. And if we want to achieve those, as Mrs. Robinson was saying, we have to address adolescent fertility. The 17 UN Sustainable Development Goals, all of them will impact the adolescent fertility, because if we can achieve these, move towards those targets, it means that there are fewer risks for adolescents. And I also remind us that gender is a cross-cutting issue to achieve all of these, reducing poverty, hunger, promoting health equality, and all of them. I flag some of the critical SDGs for that support adolescent girls. So target 3, SDG 3, which is on good health and well-being, speaks about promoting maternal health, child health, and also universal access to health. SDG 4, which is on quality education, speaks about universal primary and secondary education, but also underscoring the importance of early childhood development and universal pre-primary education. And that has implications too for care work. We need to have adequate care work to support our adolescent mothers. Then we need equal access to technical and vocational and higher education, which is one of the things that the Women's Center Foundation is in fact affording to adolescent teens. Relevant skills for decent work and gender equality and inclusion. And I just want to pause to say that inclusion, one of the areas that we need to be thinking about very much is the inclusion of persons with disabilities. What are we doing in terms of sexual and reproductive health and rights for persons with disabilities and different kinds of disabilities? And of course, universal youth literacy. SDG 5, with the key targets are ending all forms of discrimination against women and girls everywhere and eliminating all forms of violence of women and girls in public and private spheres, including in trafficking and in sexual and other forms of exploitation. So I use these images to underscore messages that have been noted earlier, that gender inequality drives adolescent pregnancies. Many of our families are single female-headed households. When we look at our roles and responsibilities and our identities, we see a common feature is unequal power, unequal access to assets and resources, but also unequal risks. So what is this gender gap report telling us? The World Economic Forum, and I encourage you to look at the World Economic Forum's Global Gender Gap Report each year because it gives us some very valuable data. Jamaica ranked 40 out of 156 countries in 2021 with a score of 0.741. And when you look at the labor force participation rates for women and men, you'll see that there are fewer women actually participating in the labor force. And we know that is because women are the main caregivers for their family, and we have more women in caregiving. We also know that the estimated earned income for women is less than that of men. So we have female-headed households, fewer women in paid work, they're earning less, but women have higher levels of education, and that includes literacy rates, enrollment in primary and secondary and tertiary education. And we have several single parent heads of households, and they are in the poorest families, and those families have more dependents. So if you have a larger family, more dependents, it's a risk for the boys and girls because it means that the money that is there available to that single mother has to spread more widely. I next look at the issue of COVID-19 and climate change. And this discussion today is taking place within the context of the COP27 meeting, which ends tomorrow. And loss and damage is one of the critical things of interest or debate. And as small island developing countries, we have an interest in seeing what's happening and the outcomes of those because we need funds for adaptation. But all of this, COVID-19 and the COP, the climate change, does have an impact on adolescent pregnancy. So this image from UNICEF says that we have 168 million children out of school. And we need to think of what this means for future generations, and underscores the importance of the work that the Women's Center of Jamaica Foundation is doing to ensure that the children go back to school and complete their education. For Jamaica, we saw that in March 2020, we heard that 600,000 Jamaican children were out of school due to lockdowns. And my question is, how many of those adolescent girls became pregnant between March 2020 and November 17, 2022? We know that there were challenges with internet access and other issues. How many dropped out because of lack of computers and internet? We know that there were financial hardships, depression, and mental illness. So those are issues that I think we need to also consider when we're looking at numbers. This image here on the gender impacts of COVID-19 tells a lot of stories. Mrs. Roberts will tell you that as the mainstreaming gender, which we are committed to very much, looks at gender in social, economic, and political and environmental areas. And we note that the economic downturn impacted women and men differently. There was increased unemployment, and we know already the higher levels of unemployment for women. There were downturns in major industries, with tourism in particular, many women working in the tourist industries. Loss of income and jobs. We had fewer remittances because of the global pandemic, and we depend on those from family members abroad. So we had increased vulnerabilities of households, and there were higher job losses, but there were also reports of increased gender-based violence and sexual harassment. And then there were increased care responsibilities for mothers. So you'll see the issue of mothers trying to also help with the homework and do the teaching at home and so on. So it was very stressful. Now, this image from the Climate Change Summit, which is happening in Egypt, it's a girl. We have a picture here of a girl walking to school in Ghana, because the issue we're discussing today is very much part of the agenda of COP27. And the quote here is that the negative impact of climate change on educational attainment undermines the socioeconomic prospects of girls. And this article in World Bank by Hassini tells us the barriers to girls' education are multiplied by the effects of climate change. Climate change can put girls at greater risk of child marriage. And if you think of child marriage in the broader sense, it means girl children being attached to a partner before the age of 18. Climate change also can impact access to health services, and that increases the risk of unplanned pregnancies and sexual and reproductive health challenges. So inability to get to health centers and provide the services that you would normally have, reproductive health services, is also impacting. And then the environmental stressors, less resources, increases gender-based violence and rising exploitation. So we come to the crux of the matter. The trends we're seeing, is it fact or fiction? And my argument that we need to connect the dots to find some missing girls. So the Pan American Health Organization's population pyramid of 2022 tells us that we have 216,650 girls aged 10 to 19. And in two age groups, the 10 to 14s, 103,956, and 112,694, 15 to 19. My question is, what are we counting? Is it adolescent pregnancies? Is it birth to teen mothers? If so, of what ages? The fertility rate, 15 to 19 years, doesn't always include the 10 to 19, right? So you have the age-specific adolescent fertility rate of 10 to 19, and then you can break it down into 10 to 14, 15 to 17, 18 to 19. So we need to be able to see what we're talking about in terms of adolescent pregnancies in each of these groups. And again, the question, which girls are missing? It's important because we can't have to support the girl child to prevent pregnancy, continue her education, care for her child or children, enable her to fulfill her career goals. And when we can do that, we have future leaders, scientists, innovators for the 21st century. So this is very, very important. Those of us in Jamaica may remember the Ananda alert. And I remember when I was at IGDS, we hosted a forum when Ananda Dean was killed. And that sparked a national outrage in 2008 and led to the formation of the Ananda Alert. So there's an app that is used. That's a beautiful picture of young lady. And this has been ongoing since 2009. And here's some data from the Ananda Alert. In 2018, 1,518 children were reported missing. And that was the lowest figure since 2009 when we started to count. But look at the gender difference, 3-1 in favor of the girls, more girls than boys. In 29 of this number, 155 girls and 31 boys were still missing. 1 boy and 4 girls were reported dead, unfortunately. Then we have the Child Protection and Family Services Agency reporting in 2022 that between 2017 and 2019, 6,686 children were reported missing. Again, we see a wide disparity with more girls being reported missing. Thankfully, 5,106 of those children were returned, but we still have 1,560 children still accounted for. Is that part of the reason that we have these trends here? This is just a picture taken from the internet, from the Ananda Alert, and you'll see that these are young girls who have been missing. I also draw to attention to another area of research and work that I've been doing over the years, and that is on human trafficking. And the annual TIP report, Trafficking in Persons Report 2022, underscores that more adolescent girls are at risk of sex trafficking. And I just want to say thanks to the Office for the National Rapporteur and the national network of organizations that the government has for working on human trafficking. But some of the children could be victims of human trafficking. We also know that, unfortunately, we have children who are working and living on the streets of Jamaica. So this is a study done by the CPFSA in 2021, and 37%, 137 of those 373 respondents were females. And I just want to share some of the quotes which point to some of the issues that we're dealing with and why we might have missing girls. Miss, sometimes when you reach 13, parents don't business with you. Many children have stopped working on the streets and are now selling their vaginas. That's why you don't see them on the roads. That was from a focus group. From another focus group, the quote, the majority of girls do not go back to school from 13 years. They get pregnant and cannot go. And by 19, young women are expected to have had 3 children and perhaps with 3 different baby fathers. So you see that this captures some of the issues that we're dealing with, that the Women's Center of Jamaica Foundation is trying to address. We also have this Jamaican National Youth Activity Survey in 2016, which also looked at children 5 to 17. And the takeaway from this is that 32.1%, or 12,168 of those children in child labor were girls, 67.9 were boys, and 3.8% of these girls were girls. So the question I ask is, how many girls 5 to 17 are in child labor, into sexual activities since COVID, and how many may have become pregnant? These are questions that we need to ask. There was also a Caprice study in 2022, which highlighted the gender-based violence pandemic. And they focused on intimate partner violence and domestic violence. And the impact on teens is what we want to note. A 28% life prevalence of gender-based violence, but also underreporting. And this is not unique to Jamaica, underreporting of domestic violence. And it notes that only 7 reported abuse from an intimate partner in the previous 12 months. That was the Caprice study. And then there's a quote in an article from the Gleaner newspaper, nearly 100% rise in domestic violence reports in the years. And it said annual number of reported cases of domestic violence increased from just over 4,000 to around 8,000, a rise of 100%. And that was by Xavier Main, who is the Minister of State in the Ministry of National Security. Then we look at a big problem. Unfortunately, the data on unintentional homicides, Jamaica has the second highest rate globally. 7.6 per 100,000 women are killed. And the global average was 2.2 per 100,000. And this is from the World Bank data. So you see the trends of violence and the fact that some of these females who were killed could have been adolescents who were pregnant. The Inter-American Development Bank also noted that there was a 10.3% increase in domestic violence since COVID. Now, although we were the lowest rate of increase across the Caribbean for the countries reported in this Cornell coronavirus survey, 10.3% is still worrying. Again, the theme of violence and how many of these were related to adolescents. So having presented that data, I look at some possible explanation for the trends in reduced pregnancies that were reported. Question, was it improved adolescent sexual and reproductive health advocacy and education? So we see here a poster from the Pan American Health Organization and UNFPA promoting dialogue, no child mothers, accelerating the reduction of adolescent pregnancies. And there's an Adolescent Pregnancy Prevention Week in the Caribbean, which is commemorated. We also have this Spotlight Initiative, an initiative to eliminate violence against women and girls with UN and other partners. And then the Orange the Day, Orange the World campaign, a global campaign, which we are about to commemorate November the 25th, the day for the elimination of all forms of violence against women, and 16 days of activism. And here in the Botswana University, we had a very good event last week because they had to have this before they start their exams. We have also a question. Is the reduction we're seeing linked to the Ministry of Health's 31 monthly adolescent health clinics across the island? And I think this is just very commendable. We have the Victoria Jubilee Hospital, which has a teen clinic, and then we have adolescent health programs in the other health centers, 31 of those monthly, which I thought was really very commendable. So it's the downward trend, part of what we're seeing because there is reduced pregnancy, we don't know. I also noted and asked whether the teen hubs are part of the reason for the downward trend. So the Ministry of Health and Wellness first established a teen hub in the busy Halfway Tree, Kingston, and it enables adolescents, 16 of adolescents, to access health, education, and social services, but also pregnancy screening. And there's public education. The National Family Planning Board, which is an agency of the Ministry of Health and Wellness, integrated sexual and reproductive health and HIV programs, and they provide access to contraceptives. They have an adolescent newsletter for HIV positive teens and much more. So please visit their website. And we wonder if this is part of the reason we are seeing these reductions. I want to also ask whether the work that the civil society organizations on prevention and support are also contributing. And I've just raised a few of them. There are many others. Children First, the E for Life program, and they commemorate the International Day for the Girl Child, which is celebrated in October each year. But there are several civil society organizations and faith-based organizations which are also supporting prevention and support. Then I also acknowledge that ministries, departments, and agencies, academics, and international development partners have also been active. So I just highlight some of them here and say that a significant body of research has been done. We can draw on that, and the agencies working together can in fact reduce risks. Is it, however, is the reduction, however, due to abortions and miscarriages? And here's a quote from the National Family Planning Board Reproductive Health Survey, which was done in 2008. Although it's dated, it says a lot for me. It says, because data on abortions and miscarriages are underreported in surveys, most of what we know about adolescent pregnancy in Jamaica is limited to teen birth. So it says that We focus on the births because we don't know about the abortions and miscarriages. Because abortion is illegal, we can't count it in the same way. Then the World Health Organization also focuses on the risk of girls below the age of 15 years. The data on childbirth among girls aged 10 to 14 is not widely available. And 55% of unintended pregnancies among adolescent girls 15 to 19 end in abortions, which are often unsafe in low and middle income countries. And there are lots of health risks, which this other slide shows us. It's risky. Adolescent pregnancy is risky. High blood pressure, low birth rate, higher rate of infant mortality, anemia, back pains. The baby's head is wider than the pelvic opening, and this is from Plan International. But we also note that there's a risk of intergenerational poverty and child abuse and mental health problems. So if we don't intervene and support programs like the Women's Center of Jamaica Foundation, we're going to have successive problems with poverty and abuse and mental health. So the bottom line, ladies and gentlemen, is that and this is a quote from the State of the World Population Report, the truth is that any fertile woman of reproductive age can experience an unintended pregnancy. I repeat, any fertile woman of reproductive age can experience an unintended pregnancy. So I raised some questions for discussion. We note that despite commitments to the Cairo Program of Action, the ICPD Program of Action, which countries renewed in 2019 in Kenya, ICPD at 25, a lot of research has been done, a lot of advocacy and efforts over decades. Abortion continues to be legal. And if Capri's estimate of 20 to 25% of adolescent pregnancies are terminated, is that contributing to declining adolescent fertility rates and reduced enrollment at the Women's Center of Foundation's 18 locations? Now, as most of their clients are girls from low-income and rural areas, my question is, what's happening to pregnant adolescent girls in middle and upper-income areas? And then if the reduction in births to teen mothers is partly due to abortions, where are the girls accessing services? Are these services consistent with the WHO's protocols for safe abortions? What methods are we using? So I raise these questions for discussion. Here are some main takeaways as I conclude. We need more research. We need to expand research to fill the data gaps on adolescent pregnancies versus teen births to teens. We need to connect the dots, which I've raised in this presentation. We also encourage the Women's Center of Jamaica Foundation to do an impact assessment and document the achievements and lessons learned from 44 years. There's scope for education, expanding and supporting education, making a plea here for affordable childcare and social protection, so that when the girls do in fact go back to school, they can in fact get the support for universal childcare in communities, but also economic empowerment for women. And I know that the Women's Center has started to look at economic empowerment and business and bring those skills in. So we need to support them to expand those. Then there is prevention. We need to expand our sexual and reproductive health services to fulfill the commitments we have made at the global level, which will impact our achievement of sustainable development in our Vision 2030. But we also need to review policies about the reintegration, access to contraceptives for minors, but also access to comprehensive sexual and reproductive health services. We also need to do more public education to end the stigma and discrimination against pregnant teens. We also encourage parenting and family support, expanding programs that target the baby fathers and the families on both sides to support the girls and their babies, as well as consolidating the partnerships and expanding those to support adolescent girls in the future. So I'm saying that the time for action is now. We've been doing work, but we need to ramp it up. Girls' education is our future. And this quote from UNESCO says, more than 15 million girls are at risk of not going back to school. Let us dedicate ourselves to ensure that all of them can. but also prevent those pregnancies. And I end with this image of this mother, baby, and elephant in Botswana. The elephants are family groups. They look after each other. And I said that we need to support our girls and ensure that we help them to protect their babies as we move forward. And in closing, I just want to say that this lecture, I hope, will enable greater collaboration between the partners in Botswana and in Jamaica. We can use the experiences of several days that we have available to us to commemorate and draw attention. Let us not forget the hidden groups, the hidden girls, including those with disabilities. So I just want to say that there is scope for partnership between Africa and the Caribbean as we move forward to protect our teen mothers. Thank you very much.
Thank you so much, Dr. Dunn, for that informative and rich presentation, and so illuminating, as someone is saying here in the chat. So we do have a few questions. I do have some points that I would want to discuss, but I do want to open the floor for everyone to ask questions. I know Sananda, I hope I'm pronouncing that correctly. Sananda Ray was asking, and I do believe you did refer to it, is there data on whether young girls who are at risk of teen pregnancy also at risk of GBV, HIV, HPV, and abuse? I know some of that was referred to, really asking about the clustering, I think, of risk issues for them. She made note that in some countries, there's a clustering of the risk with them, and also with young girls who has their sexual debut at a very early age. I don't know if we missed that, or if you could just point us again.
Yes, the linkages are there. And Sananda, my neighbor, Dr. Sananda Ray, my neighbor, is very right. In this region, the sub-Saharan African region has the second highest, well, a very high rate of HIV. And the issue of gender-based violence actually drives that. So the pictures I showed you of, for example, defilement, we're not just dealing with pregnancy, the risk of HIV infection is very real. So Botswana has actually done a lot in terms of reducing the rate of infection, but the risks and vulnerabilities, in fact, can also drive HIV. Thank you for that, Sunanda.
Yes, I see a very interesting and possibly risky question here. I love it, from DeAndre Williams-Clark, who is asking, where exactly do adolescents in Jamaica receive comprehensive health education and sexual reproductive health services? And would you say that we are meeting international standards? And even if we are saying these to the adolescents?
Yes, so there are many areas. There is the health and family life education program that is in schools, and I'm told that is being updated with guidance counselors and training. One of the issues is how are we delivering the messages around sexual and reproductive health, and are there constraints that some of those guidance counselors have in terms of how explicit they are? There can be, because the reality is that children live in one world, and the curriculum may not always match. And I'm not dissing the HFLA, I'm just saying that that is one of the issues, yeah?
Absolutely.
I know that faith-based organizations and CBOs as well, and I want to commend also what the ministries of health are doing, because even here in Botswana, I do notice that there is a lot of work being done, right? So I hope that answers some of the question in terms of where they're accessing information. But they're also accessing information and services on the internet.
Absolutely.
Right? So that's a whole other debate. Yes. I know you have several questions, so I'm going to just pause at that and ask.
Yeah, man. As you just mentioned the internet, a question, a thought that came up to me while you were giving the presentation. Do we have data, or are we in the process of really looking at what I think how maybe social media is affecting any of these lower rates? For instance, our young girls or whatever trying to say, listen, I can't have no baby on me, because I need to live this lifestyle or that lifestyle, or just whether education directly, indirectly, coming from social media platforms or popular platforms. I know that is something that I know certainly when I speak to some of my students and so on, that is such a big influence on them now, and even the younger generation, which I know we saw that coming out throughout the pandemic, when people are really just glued to their screens. And a lot of these social media influencers, social media influence came from this. I don't know if we're getting there, or are your thoughts on that, Dr. Dunn, in terms of how social media, do we believe it has started to impact any of this data?
Well, I like to follow the research, and I haven't done it, and I've been reading a lot, and that's an opportunity. But while I'm on the floor, I just also wanted to say that another area of information is antenatal clinics. And I want to big up the midwives and the nurses, and to note that Dr. Cynthia Pittel, who graduated, my PhD student who graduated a few weeks ago, did her thesis on screening for gender-based violence in antenatal clinics with a protocol. So it means providing information and services, not only to teens and mothers, not teens in that case, but also to the midwives and nurses. So there's hope. Some other questions are there though.
I'm just seeing here that someone is saying that UNFPA has been working with the HFLE teachers to help them to be more comfortable delivering the sexuality training and issues around sexual health component of the HFLE curriculum, to help that training aspect go through. So, we're always working tirelessly on the ground, trying to get that information going. I do see your question, Kamara, right? I just wanted to bring it up. She is National Jamaica Festival Queen 2019-2021. She asked that question, shifting gears a bit. Let me see if I can get back her question. Oh, all right. Oh, yes, the screen changed. Give us a minute. I know that. Go ahead, Dr. Dunn.
No, I know Dr. Shavans, who's at UNFP, had her hand up.
Yes, Dr. Shavans. I know I also saw somebody else. I could not pronounce his name, and it flashed so quickly. I don't know if our moderators in the chat could help us out. Kamara was asking, would infant and child CPR and first aid be something we should implement for teen mothers? She did say she's shifting gears a bit. I'm not quite sure how we would work that into the discussion. If she could just tell us a little bit why her thought process went to infant and child CPR for teen mothers, to see if we could help to fully understand her question. So yes, the antenatal clinics and the HFLE curriculum are people on the ground that are really helping this mortality rate, the mortality, fertility rate, and all of that to go down. I do remember one of the things, I did volunteer at the Women's Center Foundation several years ago. And one of the things I do remember the girls talking actively about is, just how they really want people to be real with them, and the teachers, and tell me about what go on in the streets with relationships and man and sexual health and all of those things. And I do believe we are definitely reaching to that level with all of this rich data that we are now being presented with. I do see some questions here. All right. What are possibility of is there any data? I'm trying to pull from some of the questions here. Data around information with the young fathers of some of these children, the partners of these young girls in the foundation, and how do we believe that has played an impact, Dr. Dunn? I think in some of this data reduction of it, just improved education with the partners, with these also young boys who are some of them. What are some of the possibilities?
So working with men, and again, working, sexual and reproductive health has to deal with everyone, right? And working with boys and the baby fathers is something that the Women's Center of Jamaica has done. I don't know if Dr. Zoe or any of the others want to weigh in, but I think this is one of the areas that actually needs to be strengthened and expanded, as well as with the parents of both children, the parents. So sometimes the burden falls on the mother, the girl's mother. I think it's also important to engage the family of the baby father then. Dr. Zoe?
Thank you so much, Dr. Dunn and Ms. Shauna K. Burns. We are delighted. Well, I'm not yet moving the vote of thanks, but in terms of responding, I'm eager, can you tell? In terms of responding to that matter with respect to the young men. We, once upon a time, had a very robust program for the young fathers even. We kind of scaled down a bit even, but we have recognized that, yes, it takes two even. And so we are revisiting the extent to which we deliver a service of sorts to the young men, the young fathers. And I would probably yield to my partner, Mrs. Sharon Coburn Robinson from the Bureau of Gender Affairs, because together we are working as partners and agencies. We are working with the young fathers, so much so we have, Minister would have introduced and instituted the Young Fathers Initiative, where we're seeking to go after all the young men. And so maybe this is an opportune time to say to the wider community listening on this platform, let us engage the young fathers into the conversation so that they too would recognize their sexual reproductive health rights and primarily so their responsibilities. So yes, once upon a time at the Women's Center, we would have seen more than one girl's, well, you know, having a child for one young man even. And we would see a young man having, you know, being the father for several other babies and so on. So as we engage with them on the street corners, wherever they are, we are going after the young men to have the conversation, for them too to recognize that they play a pivotal role in the reduction of adolescent pregnancy, as they even pay attention to their own personal development as young fathers.
Yeah, you know, one of the things that strikes me, colleagues, is that we need to go back to parenting.
Yes.
Sexual and reproductive health parenting, because we don't like to talk about sex and sexuality issues. And, you know, some of us came from a generation that might have clouded things a bit. The children have access to information online, and if we're not creating an enabling environment in the home to talk about their changing sexuality, their sexual desires and things, and give them that support, we're going to have more pregnancies because they're going to go out and find information. So that's another whole area of opportunity to strengthen the parenting. And it's not competing with our parenting commission or what have you. I'm just saying that the rich experience that the Women's Center of Jamaica Foundation has provides the opportunity to expand work on that. And I'm sure you have lots of support for it.
Well, this is an opportune time, if I may jump in, moderator, this is an opportune time for us to say, I don't know if Mrs. Martin Berry is on the platform, to introduce to this community, this conversation, the fact that with the support of UNICEF, we are completing a project in which we are presenting to the world for the first time a robust curriculum for adolescent parents. And yes, stand by, because this will be published soon. Pivotal. Mrs. Berry, did you want to say something about it? I know it's your baby, you have it in your bosom, you want to run with the conversation where that is concerned, as we seek to position our young girls and young boys to become transformational parents. I'm yielding to Mrs. Berry. Is she there? No, but bear in mind though that listen out for it, because we're going to be publishing, and we want to say thanks to UNICEF who walked us through this process for around about 18 months, and we're about to now put that out there to the wider population. Thanks.
Thank you. That's great news. And I'm sure that Mrs. Robinson would want to support the idea of it being gender sensitive parenting. So we're not reinforcing stereotypes.
There you
Mrs.
go.
Robinson, she has her hand up actually.
She does have her hand up. Go ahead, Mrs. Robinson.
Thank you so much. Thank you so much. You know, I looked forward to this, Dr. Dunn, and you did not disappoint. It's just totally rich. I am so full, I don't need dinner. As a matter of fact, I don't think I can for days to come. I love everything that was discussed, and I also like the fact that Dr. Simpson just mentioned the fact that the support that's given through UNICEF for that adolescent parenting. So she mentioned earlier that we're working together, as we do all the time, on just making sure that the young fathers are supported. She mentioned the fact that we had a very robust program before, and then there's a little hiatus. So our minister thought of having this renewed, and so she came up with something that allowed us to be able to do some work together. It actually started with research that was done under the IGDS, and we have a publication that allowed us to see how it is that some of these fathers are speaking about what they want to see done, how they want to be assisted, some of the issues they're having, some of their challenges, and just trying to be as real as possible, speaking about their lived experiences and, you know, some of the challenges that they have, which they need support on. So there are 3 programs that we work on. One is in close partnership with the Women's Center, and that's a Young Fathers program, the Young Fathers Initiative, that allows us to have that interface with young fathers. Quite a few of them have persons who are a part of the PAM, the Program for Adolescent Mothers, and they have experienced lots of challenges, you know, stigma, discrimination, a number of things. And they have shared with us, and we have seen the call, the need, the call that they have made in terms of partnerships, making sure that there is funding to support that. And we have actually gotten a chance to be speaking with some of our partners to see how best we can support them. The other one quickly would be the Mentor Me 2020, which looks at just mentoring. It started in 2020. We actually have dropped the 2020. It's just Mentor Me Male Initiative. And I should say here quickly that on Tuesday of this week, we're going to do the International Father's Day, International Men's Day rather, IMD. And during that observance of International Men's Day this year, we want to bring these young men in. We had a blazer drive just recently, and we're very happy to get quite a few blazers. So they will be coming and just having a strong showing, because we've been supporting them along with the support we get from the Women's Center in terms of giving us some of these persons who are fathering some of these girls. And the final one will be the GAP. GAP is Gender Ambassadors Program, and that looks at the nexus between gender and education. I am very happy for that, because it allows for a number of students in schools to be mentored. And this became a very important part of what we're doing, because we recognize that the schools were saying they need help with some of these students who were having a number of issues, quite a few issues. And some of them were not having issues, but they just wanted to know how to work better with their peers, and how, for example, to do leadership and to do, you know, decisions in terms of choice of career, how to be better students, and how perhaps to just be better persons in general. And so we've had lots of successes, we've had lots of challenges, and, you know, together when we work, we've seen that, you know, COVID-19 has had challenges, and it has provided lots of opportunities. We've seen a litany of peace, partnerships that came out of that. Several partnerships, political will. We've had the opportunity of engaging the politicians to see how, especially our minister, we can get support for these persons. We've seen the importance of perseverance. We've stuck to it. We've encouraged them to persevere and to emulate perseverance as something that's very important. And finally, the importance of, and that was mentioned earlier, parenting and family support. That cannot be overemphasized. And I think we can do it as a team. There are so many strategies that are available. There are so many resources that are available. And I think we need to tap into them, as we have been doing, and just continue the conversation, link with our partners. I heard earlier Dr. Chivans talking about the UNFPA and that strong support. And I know that it is possible, it is doable, it can be done, it must be done. It is a developmental imperative. I thank you.
Awesome.
Yes, we thank you so much for that response, Mrs. Robinson. And I think this is an awesome time to just wrap up the Q&A. Once again, we thank Dr. Dunn so much for her continued investment in the foundation. Once again, for a riveting lecture, just information and data that we just move away with. I know some of our questions perhaps did not get answered, but we do want you to continue the discussion in your small corner of the world. And I think that is really one of the main things about these annual lectures. Move the conversation into your schools, into your homes, your communities, your workplace, so that we can continue this conversation. I just want to thank everybody for their participation. Thank you for coming online. We also want to quickly mention our social media pages. Remember that this lecture can be viewed at the YouTube page. The YouTube page is the Women's Center of Jamaica Foundation. The Women's is WOMEN''S and Center, the British way, CENTRE. Also look out for our Facebook and Instagram pages. The handles are at womenscenterja.com for the platforms, and just type us in. Thank you so much again, Dr. Dunn. We want to thank Dr. Carpenter, Mrs. Salmon. We want to thank the people working assiduously in the background, and I will move before I take her thanks from her to Dr. Simpson to give us the official vote of thanks and thank us for joining us online today.
Well said, Ms. Shauna K. Burns, moderator. Thank you so much. You did an excellent job. There's very little for me to say. I'm happy to hear that. But I acknowledge Mr. Denzel Thorpe, our permanent secretary, Mrs. Debbie Ann Brown Salmon, chairman of the board of directors, Dr. Karen Carpenter, head of department at IGDS UWI, our partner, Mrs. Sharon Coburn Robinson, Principal Director at the Bureau of Gender Affairs, Dr. Dunn, our guest this afternoon, guest presenter, specially invited guests from all across the world I'm seeing. Ladies and gentlemen, good evening, good night by now in Botswana and the UK, I suspect, and in other parts of the Caribbean. For several reasons, though, some of which I won't tell you yet, I am delighted to give the vote of thanks this afternoon for the 2020 edition of the Pamela McNeil Lecture. Did you hear how I pause at that name? We owe a lot to Mrs. McNeil, who gave her life and her substance to establishing this program for adolescent mothers in Jamaica. We have endeavored since November 2018, ladies and gentlemen, as you know, to situate the lecture on adolescent pregnancy within the context of the current pivotal issues, attempting therefore to identify the salient issues and to bring all stakeholders to the space, a space within which to have meaningful, robust conversations such as we had this afternoon. Mind you, we're not interested in mere talk. This is not a talk shop, mind you. Anyone can talk. Yes, but when all is said and done, we must all rise to the task to ensure that no girl, no adolescent mother, and no adolescent father either is left behind. This year's lecture was framed within the context of the COVID-19 pandemic, as you realize, which left us with several questions yet to be answered. So the conversation continues, and as our moderator said, we will continue the conversation outside of this platform. Let me therefore thank the chairman of the board of directors, Mrs. Debbie Ann Brown Salmon, and other directors who joined us. Mrs. Salmon certainly set the stage with her very warm welcome. No wonder all of us are still here on the platform this afternoon. Thank you, Chairman. Although our Honorable Minister Olivia Grange was unable to join us, she registered the import of this conversation to her and to all of us by having her remarks delivered so ably by our partner in the gender portfolio of her ministry, Mrs. Sharon Coburn Robinson. Thank you, Sharon. You know where you belong, right here beside us. In as much as you were here several years ago, as you said already, you have a place with us. We particularly thank our presenter, Dr. Leith Dunn, for having made herself available to deliver this year's lecture with such ease and clarity and agility and passion and rigor and insight. After all, Dr. Dunn, you have been journeying with us as a foundation from the conceptualization of the lectures in 2018. You sat at the table, you came over to 42, sat with us and helped us to position the lectures and partnered with us. And you are here this evening delivering the lecture. And we thank you so much. I'm seeing that your children have followed you onto the platform very well, Jessica, and your son as well, cheering you on. Jamani, very well. Thank you so much.
Jamani helped to this presentation.
No, you tell me. And very, very good. Very good. That's how family is. Family. And Women's Center is a family. And so we are inducting them in the family this afternoon. Very well. And the conversation continues then. We heard the questions you asked. Which girls are missing coming out of the pandemic? Because at the Women's Center, we recognize that we are not seeing all of the girls at all. Every time we go to the hospitals, every time we go to the health centers, every time we go in the communities, we recognize that the girls with which we interface, you have a pocket of girls who are not coming in, and we are going after them, mind you. We heard the question, how can we a child to prevent a second and a third pregnancy? And the first pregnancy, by the way, we have to protect the girls. We heard the question, what is happening to pregnant girls in the middle and upper income areas of the society? So like at the Women's Center, we see a lot of the girls and we recognize they're usually within a certain socioeconomic strata, but we recognize too that pregnancy there's no bias, mind you. And so chances are, we're just asking the questions, And we heard them ask this evening, where are the girls accessing the services? Private sector, we're going after them as well. Against the background of these questions, though, we heard a clarion call, Dr. Dunn and everyone on the platform. We heard the call for more research to be done, for us to continue to educate the girls and educate the wider society as to the importance of educating teen mothers, because unfortunately, we still have some persons. We've come a far way as a country, but we still have some persons who think the girl is pregnant, she doesn't belong in school. Not at all. It's her right. And yes, not everybody is academically inclined, but everybody can learn. That's what the Ministry of Education says, and we believe that. And they must find their places because they are gifted in one area or the other, and we have to help them to find their giftings. We heard the call for prevention as well. We have to expand the SRH services to fulfill commitments. The policy review, it's long overdue. I heard it. It's 10 years. It should have been reviewed quite a few years ago. We're going to do it in next year, I think it is, when we celebrate the 10th anniversary. And the policy, we really thank the Ministry of Education for walking beside us in the implementation of the policy. At the Women's Center, we can breathe a little better because the policy has made our work so much easier, the work of having the girls reintegrated into the formal school system. Ministry of Education, we must review the policy because we recognize that there are some gaps that need to be filled where the policy is concerned. Public education, parenting and family support are some of the areas we must also expand and begin to look more closely at. Partnerships. We extend our hands out for everyone to help us. There's an A-stream program, advancing sexual, tertiary, remedial education for adolescent mothers, where we invite the public to support a girl who is going back to school. Some of them can't go back to school because they can't afford the school expenses. No girl should be left behind on account of a pregnancy. Doesn't have to stop her, prevent her from achieving her goals, her life goals, and maximizing her potential. At the Women's Center, we can't do it alone. So we still invite persons to have the conversation with us as to how you can make the difference in the life of one girl, just one. I wish to add to Dr. Dunn's list of activities in the call for action, though, and to invite the wider society. Not everybody's on the platform this evening. We anticipated we'd have had some more persons, but those of us who are here, take the message to them. Help us to identify, help us to locate the girls coming out of the pandemic, help us to find them, and help us to encourage them to come to the Women's Center nearest to them. register in the Women's Center program for adolescent mothers. And we take the girls right up to 18 years old, and we identify their needs, their special needs, and we invite them to come. We have the services that you need. We want to talk about your sexual reproductive health issues and to help you to position your lives where that is concerned. We want to help you to do your CXCs and your city and guild examinations. We want to help you to hone some skills, life skills, but also vocational skills that will help you to improve your economic prowess. We have the answer for the girls in Jamaica, the adolescent mothers, the adolescent fathers as well. And we invite persons to help us to locate them, bring them in so that we can assess their needs and deliver the needs as need be. We have on the platform this evening several persons from different ministries and agencies and departments, government departments and so on. Thank you so much for coming. International donor partners who are here, inclusive of all the UN groups. Specifically want to thank the UNFPA because they were, alongside of IGDS, one of the first sponsors and partner as we deliver the lecture in 2018. UNFPA, you have continued to walk beside us with the lecture, with other projects. Currently, we're doing a project with UNFPA. They've always supported us. PAHO International is also here. KUSO International, all these international donors. But of course, we have local donors who are on the platform this evening. We want to recognize you as well. Some persons, some of the names were mentioned already, and I know it's time for us to go. But I have to say the local donors who have been partnering with us on the ground across the island, in all the centers and the outreach stations, we want to thank you for coming this afternoon. Representatives from the local and international universities have always stood beside us as well, and we thank you so much. The UWI, University of the Commonwealth Caribbean, Northern Caribbean University, International University of the Caribbean. And we're happy to see that we had representation from Nottingham Trent University. Jessica Dunn in the UK. Wonderful. We're going to be having some more conversations with you as well. The Botswana University community. Dr. Dunn, we heard it from the horse's mouth. You know, we heard it from you. We're going to hold you to it. We will be working closer with the university in Botswana and the community as we go forward. Individuals from CARICOM, the CARICOM Secretariat. We recognized too, we had persons from the PAM, Program for Adolescent Mothers in Grenada. Wonderful. Again, you're here with us. St. Vincent and the Grenadines, you were here represented. St. Kitts, your Program for Adolescent Mothers was also represented. And I'm sure we had somebody from Guyana and our friends from Suriname as well. Many thanks to everyone for having joined us today. All of you were here before last year, the years before, and you're back registering your contribution and signaling that you support the work of the foundation, and certainly you want to help the adolescent mothers. Thank you so much. We're confident that all being well, you will be back with us next year. Noting that the lecture is delivered each year, the third Thursday in November. Put it in your diaries. We will be back, and we're confident of the partnership with IGDS and increased sponsorship from other donors and so on. We will be back, Dr. Carpenter, walking beside us together. Ladies and gentlemen, I pause to recognize the assiduous efforts of the staff of the Women's Center. The paper that was recently published, and if you want to get information as to how to read it on the success of the work of the Women's Center, published, sponsored by PAHO International, it tells you that the staff of the Women's Center would have significantly contributed to the sustainability of this program. This evening, I want to thank all of you across the island, along with the girls who are listening in on the program. It is on account of you that we're still here. In particular, I want to highlight the work of our public relations manager who coordinated this evening's activities, ensuring that it was a success. Thank you, everyone. Many thanks as well to the GIS for hosting the program. And we will be working more closely with the GIS in the future, doing more things, having other conversations as well around the concept of the phenomenon of adolescent pregnancy. Ms. Shauna K. Burns, you're good. We thank you so much for ably and with such agility coordinating, moderating this afternoon's program. We close out feeling delighted that this was an informative, insightful, instructive, engaging. You find the adjectives. We are just delighted, and we thank everyone for making this possible. Walk good. Have a good afternoon. We talk some more about other matters surrounding adolescent pregnancy, not just in Jamaica, across the Caribbean, across the world. And we have the questions, we have the data. We certainly will continue to reflect on the data because we still have some questions that we need to answer as it relates to how the pandemic affected the adolescent population. Have a good evening, everyone. Blessings on you all. We see you again next year. Thank you.
Have a good day, everyone.
Bye. Bless you all. Thank you.